Good afternoon and welcome. This is Julia Esparza, and I am very happy to welcome you to Discussion 9, Practice Assessing Consumer Health Websites for Quality. This is the 9th discussion in our GeauxConsumerLA Health Initiative. It is a international, and I'm not sharing my screen, that's always, wrong one. Sorry, sharing wrong screen. It is an international educational program that provides free, short, on-demand consumer health education for librarians, information professionals, and staff with an interest. If you have a minimum of 12 hours, which includes Beyond an Apple a Day from the Medical Library Association, you can apply to obtain the Consumer Health Information Specialization from the Medical Library Association. There are 2 levels, Level 1 and Level 2. Videos for this session, after I stop fighting with YouTube, and yes, I'm still fighting with YouTube, will be put up as soon as I can, get them up. And after they're up, then they will be, the transcription will be added to them. Credit for the discussions is only obtained after you have read the material. Part of this whole project is that we wanted to make it as least demanding as possible, but also provide a good quality overview of consumer health. And part of that is reading the article that's attached or the chapter that we've been able to obtain for you to read. So you do that. You can watch the session first and then read it, or read it and then watch the session, but you have to do both. Then you can go in and claim credit. Those in Louisiana, Arkansas, New Mexico, Oklahoma, and Texas, because this has now been expanded out to all of the South Central region, if you have taken a Beyond an Apple a Day and the additional hours to reach 12 or 24, you can apply to have the fee for the Consumer Health Information Specialization Level 1 or Level 2 waived. So we're very excited about that. But however, you have to have all your credits in, and you have to send your documentation in to me by March 31st. So it's getting close. You don't have to have, it doesn't have to all be hours from here. If you have other time from a different session, at least needs to be 1 hour from this set of education. And you can learn more about that here at our website, and David Duggar, my colleague, is going to put that into the chat box. We'll put this link in there. There's our website. It's got the primary courses that you can take, which also has a link to Beyond an Apple a Day. Our discussion course listing, which this is a part of. And we want to thank the National Library of Medicine, National Institutes of Health, and the National Network of Libraries of Medicine through the University of North Texas Health Sciences Center, that we obtained a grant through them to provide this education and to obtain the money to offer the waivers. So we're very excited, and we thank them a great deal. And if you want to learn more about them, you can go to this website. It's real easy, so I don't think David needs to put that in. Of course, I'm choking. So today, I am your speaker, partly because we are not necessarily exploring anything new as far as literature. The literature that's covered in this week was also covered last week when we had Courtney who talked. And this week, we actually went in and assessed websites. So I don't know how this is going to work as far as interactivity, but I'm going to go over some of the categories. I do want to thank Erin Reardon. She helped me with some of the classification for some of the websites because I had a conflict and was trying to get them done. So I appreciate her assistance. So let's go ahead and get started. This is, as I said, practicing assessing consumer health websites for quality. And so when we did this, I asked you to look I posted on the Go Consumer website, there is a form that I asked in a variety of different formats that you could utilize and fill out. And I wanted you to go to 2 different websites, the American Diabetes Association and WebMD. One is all strictly not-for-profit. The other one does generate money off of it. So that's one of the things that we wanted you to look at to see how do they compare in the great scheme of things, especially using this criteria that Courtney Schrock discussed last week. So if we go and we can look at part of the criteria right here. So this is one of the supplements to the reading from last week, and this goes into the details of what each sorry, I swallowed wrong and now just keep doing it. This is what goes into to understanding and interpreting what you're supposed to evaluate when you're looking at a website. I found this very, very intriguing because it comes up with things that I had never thought about before I had read this article. And so it was very interesting to think about all of the things that you just, as a consumer, even as a librarian, you haven't thought of before. So let's go ahead and get into this discussion. So, and I have the wrong one. Here we are. Okay. So the first part, this is the website information reliability checklist, and that is this one. And let me make this a little bit bigger so you can see this. So this is, when they were doing in the article we read last week, they actually assessed a whole bunch of websites using this criteria that they developed after deciding what was important to know about websites and what quality they were. So the very first thing that they have down is identity. And so when you go in and you look, both the American Diabetes Association and WebMD both have the name of their organization on there. Their contact information is, for American Diabetes Association, is right on the web page, just like they want for their criteria. The WebMD, you have to go into the Contact Us section in order to find any of that information. The identified source of funding for the website. Now, I found this very interesting, that both of them have pages of corporate sponsors. So, and the American Diabetes Association actually has different levels of corporate sponsors. So they have a different group for each. So if you go in and you look under their corporate sponsorship, and I was very surprised about this, they have the Banting Circle supporters, the National Strategic Partners, and the National Sponsors. So these are, the Banting Circle supporters are people who are actually tied into diagnosing, treating, working with them to help promote healthy living in diabetics. The National Strategic Partners are people who may actually have plans put in place for their strategic goals, and then they have their national sponsors, which could be anybody. These are basically your advertisers. So like the pistachio organization is one of their national sponsors, which I thought was very interesting, pistachios. So that was kind of a interesting point. The WebMD, they have health solutions. They don't have anything that says specifically, you know, sponsor in that regard. They have these health solution individual groups, if you can see, from our sponsors down here. And so, however, if you're looking at this might be very deceptive, and at least that's what I thought. this could be very deceptive because it still looks like the rest of the content. And you might think, okay, if I go and I click on have trouble sleeping, I'm going to get consumer health information. So I thought that was a little, I didn't necessarily like how they put that information together in that regard. So they identify things, but I don't think it's in a way that's beneficial for a consumer if they're looking at it. So the next section is all about purpose. And so it goes through, and purpose is talking about, can you identify the mission? Does it talk about limits and usage of whatever they put up there? Liability, whether or not they have a statement regarding commercial products and things. So this one was very interesting from my perspective. American Diabetes mission statement is right there in the middle of their page. So it's right there. It's telling you exactly, what they do, which is, you go back to their main page, prevent, cure diabetes, improve the lives of those who have diabetes. Okay? Very, very straightforward right there. WebMD, it really doesn't have anything that tells me other than the implication being that they're giving you health information. There's no place on here that really says what their mission is. If you go in and you look, oops, wrong thing. You go in and look, they have an About Us section, but that's it. So I wasn't really impressed with what WebMD had necessarily to say about that. Both of the websites had terms of use and conditions of use. Once again, they had sponsorship pages, donation pages. They, at the WebMD, do have an advertising policy, which was good. The American Diabetes Association did not necessarily have a advertising policy on their website. The next part is content development, and this is, can you tell the advertising from the non-advertising? And this is the biggest thing that surprised me, and I don't know if I just had a earlier version of WebMD in my mind. I remembered on this website that they had ads everywhere. At least that was what my thought was always. And I did not see any ads. Even when you're, clicking on specific things, they don't have ads necessarily off to the side like they used to. I found that very interesting. I had no idea that they had cleaned up so well. So that was kind of a shock from my point of view. American Diabetes Association, they don't have any ads. It's not like they had a blood glucose monitor on the page about managing your blood glucose levels or things like that. Yes, they do have money that's coming from those companies, but they didn't have specific ads. The only ads they have on American Diabetes Association is ads for their own products. So their diabetes forecast, which is sort of a patient journal, their cookbooks, other types of things, but they had to be branded the American Diabetes Association. So I found that very interesting. There is no guideline. They don't have any medical, editorial, or quality review practices on the American Diabetes Association, but they're very, very good at making sure that you know that they are not responsible for anything. They have, when it comes to terms of use, they basically say, use of this site, everything you put up is your responsibility. Everything that's up there is, they don't claim to support it in any way. and they're not liable for any of it. So they made sure that they, basically anything that's up here, they're not going to take responsibility for it. And I found that very interesting. Whereas with the WebMD, they actually have on their website, this is one of the things that annoyed me, is having to go back up and down with this website. They actually have a whole bunch of policies: privacy, editorial, advertising, correction, terms of use, all of this different information about how you utilize, how they update their information. And so in some ways, they were actually far more rigorous than the American Diabetes Association, which I found very intriguing. Authorship of the health content per page. ADA does not have anything. They have a copyright statement, and that's it. WebMD has pretty much a author link or author stated on every one of their pages. Who's reviewed it and who said that this is quality information you can put up. Do they give you background information about that person? No, but they have somebody with an MD or other type of degree listed. They both had privacy policies, and they also talked about how their personal information was protected. Well, American Diabetes actually stated that. WebMD also had a little statement about that, and I obviously missed putting that in right there. Okay, so now let's talk about the website information reliability evaluation instrument. And I'm sort of distracted because we're being inundated with water in Shreveport, and my window is currently pouring water down behind me. So that's a little entertaining while I'm sitting here doing this. So website information reliability information. So this is like user feedback. Is there a feedback mechanism? Yes. And how is the information used? They actually take and use the data, and they say, we're going to use it to help educate you or provide relevant offers and information materials. Both of them have a process where you can register to get alerts and other types of information. So this is an area where, I think that's where you see possibly more of the marketing. Once you may have signed up for that, you basically said, yes, send me that stuff. For content updating, on the American Diabetes, it had everything says it's last reviewed, it was last edited, everything, it talks about that. On WebMD, articles are dated on the first line. Other content contains dates. They archive their data after 2 years, so that's very interesting. But it can be, you can find it, but it's still archived. It only it only shows the date created or reviewed. It doesn't give you a last edited or anything like that. They both obviously have copyright dates because these are big organizations, so they're going to make sure they have that because they want to protect their value. So the website usability evaluation form, that is this form. Now this form is basically how can you use it as a consumer. And I am still blown away by that slide that Courtney had in her presentation about someone who was low health literacy, how they looked at a website with their eye tracking. To me, I had no idea. When you think about health literacy, you think about them understanding and can they read the word. I just didn't realize that it was that confusing, them looking at a website. That just never clicked in my brain. So I looked at this section a lot more differently than I had thought about in the past because I suddenly realized that this stuff is really important. As far as I'm concerned overall, both the American Diabetes and Association and WebMD get what I would consider a failing grade. I shouldn't say failing grade. They have way too much stuff on their page. I mean, if you go by what Courtney talked about last week, and you look at this page, it's overwhelming for someone who may have health literacy. WebMD is the same situation. Tons of stuff on this page. They have a little bit more white space, but look at how far you have to scroll down. So, so I found that both very interesting, that they both didn't do this as well as what the government would like to see. So when they say conventional interaction elements, what they're talking about is things like, are all the fonts the same? Or is all the text underlined? You know, click here is used all the time if that's what they want you to do. For this, American Diabetes Association did not do a good job. Sometimes on some of their pages they had dashed underlines. Other times the word was a different color or a different font. It was very different, you know, information that you wouldn't be consistent for someone who is that low health literacy who is trying to figure it out. And WebMD, they have clickable words are in blue and they have an underline and they're hovering. Pictures are also, you can click on pictures to get to different types of links. So in that regard, WebMD is a little bit better as far as consistency. They have definitely made that a priority, whereas American Diabetes Association has some issues on that regard. Minimize vertical scrolling. Minimize vertical scrolling. Say that 3 times really fast today. American Diabetes Association, most of their pages, like I said, are way too long, have too much information, hard to scroll down, up and down through it. WebMD is just horrid when it comes to having to scroll. Everything is there, you know, yes, there's a lot of information up here in this very top, but, you know, if you're scrolling and looking for something, it's going to take you a while to get down there. All right, so the back button behaving as it's supposed to. So this I had, this I couldn't at first figure out, you know, why would this be important? And then I started looking around, and especially at the American Diabetes Association, when you click on certain things, it opens a new tab. And when it opens a new tab or it opens a new window, you hit the back button and you can't get back there. So if you're a consumer, that can be very, very confusing, I felt. Now on WebMD, it didn't seem to have any of that, which was good. You know, and you can always force something to open a new tab, but that's typically something that a more advanced user of a website is going to do. Clear signal feedback, provide clear feedback signals for actions. There are many links that go on the American Diabetes Association. They're not doing that, and so let's go back here to the criteria when it says so error messages and do the buttons describe and do what they're supposed to do. So in that regard, American Diabetes doesn't necessarily have any hover over, or it doesn't really do any of that kind of information, and I'm not sure why. They do have some things here and there, but overall I rank this as a no for this for American Diabetes Association. WebMD is sort of the same way. They have different sites. They're going to generic sites, linking to WebMD's drug context, out of context, things like that. Ensure site is accessible for users with disabilities. They're linking to their videos. Almost all of them had closed captioning on both websites. There are no alt link text for images and links. So the purpose of this is to have it so that if it's an image and somebody is visually impaired, when they were to mouse over in that area, the website would say picture of child or whatever, or picture of instrument, something like that. This does not do that. So if somebody is visually impaired, they're going to be missing out on a lot of what's going on these pages because they're not seeing that. And you notice there's nothing that comes up when you're going over any of these. And it's the same thing here when you're going. Now, it does make these little boxes light up, but that's not the same thing as what we're talking about. Because this is just a website kind of thing. This is not a 508 meeting of the 508 standards. And so in that regard, they're good as far as their videos, but they're not taking it as far as they should, especially considering how big these websites are and the fact that diabetes causes a lot of eye damage and blindness. It's very surprising that they don't have that considered into their website design. So do they provide a simplified user experience? And for that, they're talking about things like, you know, do they have print options and print-friendly tools? Do they have feedback such as, you know, social media and things like that? It's easy to get back to the home page. In that regard, yes, both websites are good in that regard. Do they incorporate multimedia? Yes. They have a functional home page, which I was like, when I first started that, I was like, what does that mean? Mostly clear navigation, general site info without too much detailed content. Going back to what Courtney said last week, I would say that both of these websites have too much detail. It's not organized badly, but it's still a lot of information on here. I mean, you've got all this up here, you've got this here, you've got your top stories that has, you know, and, you know, if you want to go down, Health A to Z is down here. You know, you can get to it up here as well, but still, it's just the whole idea of how much is on the page that you have to figure out. And from what seeing Courtney having provided, that was pretty, I found both of these not very, very usable in that regard. I mean, they're functional, but I don't think they're what they should be. Present a clear visual hierarchy, yes. Both of these websites have, you know, when you're at here, if you click on this, it drops down a menu and it breaks things out. You can see there's a hierarchy of how they have things organized. WebMD is also, you know, very much when you mouse over, it drops down menus so that you can determine what's going on. They don't really have them developed into hierarchies here on WebMD, but the whole concept is, yes, you get the feel that they're taking you deeper and deeper into the website with each possible click. Easy search, yes. The American Diabetes has a search box. It does not have any predictive searching, so if I wanted to put in neuropathy, it doesn't go ahead and tell me that, you know, how do I spell that, what am I looking for, it's not predictive. Whereas if you're in here, it goes ahead and comes up and gives you a list of things, and then I can see, oh, there's neuropathy right there, diabetic neuropathy. I can see the options that I would have, and that's what this criteria element is looking at. So in this regard, WebMD does a better job than American Diabetes Association does at all. It does have tabs, but it's not searchable as well as WebMD handles it at all. They have clearly labeled content categories. Yes, the pages are not easy to skim. At the American Diabetes Association, WebMD is a little bit better, but they still put a lot of stuff on there. Do they make elements on the page easy to read? Yes, they do that. And visually group-related topics. To see a navigation list in American Diabetes Association, you have to use the tabs, and important information is at the top of the page. It's sort of a template for everything, but not all of the pages. So that's a little bit of a visually confusing aspect of it. There are several landing pages with different topics in WebMD. So they have it fairly organized well. The text and background colors contrast, and so I say yes. I am one of those, I'm a big believer in no black text with white writing on it. I know they say that that's better for your eyesight and it's better for reading, and that's why the original Kindles were so popular. I cannot, it makes my head hurt. So for me, some colored text on white is preferred. Other people may have different feelings, but both of the websites have chosen that approach, and so it's consistent. They have a focus on writing for their audience and purpose, and they have WebMD pages with outside news stories, so press releases from other places, whereas American Diabetes Association really tries to minimize the language in that regard. You can have interaction with content. Once again, this is addressing social media. Can you share articles? Can you comment? Different things like that. WebMD does a better job of making sure you know what's involved, so they have their Twitter and Facebook right there. American Diabetes Association does not have that anywhere on here, even though they do have Facebook and Twitter and everything else on there. So now, the article talked about these criteria that we've just gone through. I thought it would be interesting also to look at what the Medline Plus quality criteria has. And if you did not know that Medline Plus has a criteria, you can always go and find it. It is down here where it says quality guidelines. You just click that, and it talks about the guidelines on what they allow to be, what they will link to. So this is their guidelines. If you want to be linked to them or have a link for your web page off of Medline Plus, these are the things that you need to meet. So in that regard, if you're looking at this criteria, so they're mostly quality, authority, and accuracy is good. The mission and the goals, intended audience, American Diabetes Association, yes. WebMD, no. And I think this is a big reason why you don't see links off of Medline Plus to WebMD. May be wrong about that, but I don't think I've ever come across one. Organization provide accurate science-based information. Yes, for American Diabetes Association, it's a lot of mixed information on WebMD. It's press releases that haven't been necessarily proven, different things like that. So that's one of those interesting aspects of WebMD. The source of the content is respected, dependable. American Diabetes, yes. WebMD's reputation is mixed. It does have medical staff, but do we know the qualifications of that medical staff? It's very, very iffy in regards to WebMD. The information provided is appropriate to the audience level, well organized and needs to be used. I would say yes for the average consumer. If you're looking at someone with low health literacy, I think that both these websites have a lot that they can do to improve on that. Medline Plus links to original content, so they don't link to information that is from another website. So if WebMD is talking about an article that was in JAMA, they're not going to link to that, like if it's a press release. If it's a whole article about something that's a subject of something that was in a JAMA article, then they might, if they were using WebMD, to link. Otherwise, they only link to original content, which the American Diabetes Association is a big developer of content for diabetics. List of links are evaluated, reviewed, quality filtered. American Diabetes, yes. WebMD, no. Well, it's mixed. The primary purpose of the web page is educational and not to sell. And that is definitely with the American Diabetes Association, except for their own products, which you could say is a conflict of interest. However, for WebMD, they do have sponsored content that is clearly marked, so you know what you're seeing and what you're not. So they don't have any ads. They won't link to pages that have ads. So the American Diabetes Association, once again, passes that. While you don't see that many ads, they do have an advertising policy at WebMD, so that could affect some of the content that would be linked to. They do have a clear distinction between what's advertising and what's not on both websites. They have some things that are inferred or endorsed on both websites. For the American Diabetes Association, that is their own cookbooks and other things who, whether or not it's quality or not is solely determined by American Diabetes Association, not necessarily by outside scientific people. And WebMD, yes, but it still has some sponsored topics, content. Do they have directories? Do they endorse other organizations, things like that? American Diabetes does have links to health professionals, so you can find a doctor, find a diabetes center, that kind of thing. WebMD doesn't have lists of directories in that regard and things like that. They don't have that as one of their things that they're providing to individuals in that regard. So that's one area that's better. Both of them are well maintained. It's consistently available. It's reliable and has maintained their links. The ADA is yes. WebMD is sort of mixed if you have something that's older. The source and the entity responsible for maintaining the website is clearly marked. Yes for both of those. Information is current and up to date. Yes, and 2+-year-old content is indicated on WebMD. There is nothing like that on ADA website, but it's still, they still have some dates and things on there. Registration is not required to view their information on their site. So you don't have to be registered on the ADA site, but if you do register, you can have a lot more options for tools and saving things and interaction. So I said it's not required, but it's still registration required to view a lot of places. and WebMD doesn't require that. They do have an option for you to sign up, and once again, I think that's when you start to see a lot of their marketing. And so we've gone through the criteria, and I did it in about the time I wanted to go over it. I wanted to talk about our next speaker. I'm very excited. We have Emily Vardell. She is the assistant professor at the School of Library and Information Management in Emporia State University. Emily came out with a book that is, if you look at it here, you'll see it is the Medical Library Association Guide to Answering Questions about the Affordable Care Act. She was the editor of this book, so she compiled a lot of different chapters from a lot of different people. And she was very, very kind to get Rowan and Litchfield to allow us to have access to the full chapter of her book where it talks about the health insurance reference question. And so that's very exciting to be able to provide that to those of you who are taking this education. I also put in another bonus kind of article. It's not horribly long either. This is it's talking about how public libraries were involved with the Affordable Care Act and how they're still, and many of the things are still applying to our current situations. So that's a very interesting article to read as well. So if you're a public librarian or working in a hospital, this I think will be a session that you do not want to miss. Emily, first of all, is just a phenomenal speaker. I've worked with her on several different things, and I think that you'll be very impressed to see what she has to share. If you want to register, the registration links, David's going to put them in the chat box. There's a full registration link here, as well as a tiny URL for those of you who have problems with these getting cut off. But there's the full link right there, and that's on our Go Consumer under the Discussion tab. And my website's bad because you have to scroll down a whole bunch as well for it. Now it makes me feel bad for my LibGuide. So that will be the next one that will be occurring. Once again, I want to encourage you to go to the GeauxConsumerLA and check out the everything that's available on there and learn about the project. So for today, your evaluation, David will be putting in both these links. He'll make sure that he puts the long line survey in one in. You'll want to make sure that you scroll up in the chat after he's put it in, because you may only see the tiny URL, but the long one will be there as well. So we have that. Once again, you want to make sure that you don't go to look at that until you've read the article, that you've done this assignment for today, that you've looked at these websites and seen how you interact and work with these criteria. Like I said, it was very eye-opening for me to look at this information and to think about the websites. I really was expecting WebMD to be very bad, and I was very surprised that they were actually pretty good. And then I was surprised that ABA had some of the issues that it had. So overall, I was really, I thought this was a really great exercise from the point of view of how am I going to look at consumer health information for other people in the future, and when I'm referring a website or things like that too. All right. So if you have any questions, please feel free to call me or to contact me. And I am going to go now in, and I'm going to stop sharing my screen, and I'm going to check the chat box to see if there's any questions that have come up while I was doing the session. And I saw David posting a lot of different things, but I don't know if anybody else posted any questions. And I really do want to thank David for helping out in that regard. And I do not see anything here on the chat box for anyone. So I appreciate all of you who decided to participate. And if you have any questions, feel free to contact me. Otherwise, thank you for your time, and I'll look forward to seeing you on, get back to it, on February 28th, which is next week already, from noon to 1 with Dr. Vardell, who will talk to us about consumers navigating public health insurance resources. Thanks again.